The mention of a pharmacist often conjures up an image of this type of counting. But those involved in the profession say the role has evolved into one that can be better quantified with a clock than a pill count on a label.
Pharmacists who do specialty are able to sit down with you for an hour. And I mean, when's the last time you got to sit in a room with a practitioner for an hour and actually really discuss and work through some of your health conditions?
March is Pharmacist Awareness Month, and practitioners like Amy Lamb are shining a light on the evolving scope of their profession. Pharmacists often now specialize in certain areas, from mental health to diabetes. On top of her regular duties, Lamb is also a certified hormone replacement therapist.
Sometimes the disease is the what, and helping patients determine what the why cause may be. So if there are nutrient deficiencies, hormonal deficiencies, we help in assessing those things. If there are some offending agents like allergens or toxins or medications that are impacting their health in a negative fashion, we're helping to mitigate some of those issues as well.
Lamb sees the role of the pharmacist as working hand in hand with others in the healthcare field.
So that's going to help in decreasing blood pressure and things along those lines. So
if they are able to work with a client to analyze a malady, it can remove some of the strain on the system.
We're able to provide them with different therapeutic agents that they might have to go see a physician for otherwise. We're certainly able to do lots of alterations to prescriptions to make them more appropriate for use. If you've got a patient who's all of a sudden unable to swallow, we can change their prescription to something liquid.
Saskatoon Family Pharmacy, where Lamb works, also features a component that highlights the changing nature of the job. Here in the compounding lab, specific formulas can be made, useful if a certain medication has been discontinued or needs to be modified for some reason.
Perhaps you've been taking a medication, but you have a gluten allergy or a dairy allergy, and you've been having to deal with the side effects of the medications due to allergies. So we make allergy-free preparations and individualized dosing, where we are trying to ideally dose people to their specific needs.
Lamb stresses the importance of keeping on top of research, so she can provide advice on the effectiveness of medications, and also protecting clients from side effects when different medications are mixed. She is also a big believer in preventative treatment, which not only helps keep her clients in top shape, but can also help with their bottom line.
There's been studies saying that people are spending more money on their drugs than they are on their food or their housing. We know that medications are very expensive and that Canadians are spending an exorbitant amount of money on these things. And pharmacists are here to help you best manage your medications, and that includes financially.
In Saskatoon, I'm Simon Hiatt reporting.